So basically, BASIC is running in Lebanon. Lebanon is a pretty complex country. We've had a civil war, which means the city itself was divided into a Muslim West and a Christian East. This division has carried on in different manners in its modern history, spatially. But as well, since 2011, Lebanon has over 1.5 million Syrian refugees that have been now in protracted crisis for that many years. Lebanon, since the Nakba, has also been home to Palestinian refugees, 77,000 in Beirut itself only. Lebanon is also home to a large number of migrant workers. We have, since 2019, had protests regarding the services and standards of living and the lack of social assistance in the country, access to basic services. The August 4th blast, we went through COVID, and we are currently experiencing one of the worst economic crises in the world. I think the key issues that BASIC is currently focusing on is the fact that the state has completely disintegrated in terms of providing social assistance, which means that all the programs that are associated with the state, such as the NTTP, the emergency fund, has completely disintegrated. Historically, the state has not provided social assistance as well as services because of this since the days of the Civil War, which means we have a very wide array of stakeholders that are providing services. So the research question very basically is asking, we have these multiplicity of service assistance providers, and we also have a multiplicity of populations, which means we really want to look at who is getting what, when, and where, and from who, in a sense that we also would like to interrogate populations that have been historically marginalized, such as migrant workers, Palestinian refugees, Syrian refugees, and really examine where do they get their services from, are the systems providing equally for all, and how these are spatially segregated. I think we are focusing on the spatial segregation to understand how services are unequally, if they are provided in different localities to different populations. We would be looking to, provide different lenses of looking at social assistance in Lebanon, looking at more socially just systems that are able to provide equally for all. We are using predominantly qualitative methods. We are using interviews, but we are also using transact walks, which are, a participatory form of qualitative research, where you walk around with neighborhood residents and ask them to point out the state of services, whether it's water, electricity, anything that is visible, to really understand the physical barriers, if there are to access social assistance, or if it's like, education or more soft services, they should be able to point these out along these walks. The biggest challenges we are facing in the project is making sure that the research is planned in a way that makes sure that all the field workers are safe in their neighborhoods while they're doing research, taking pictures, making sure that everybody is aware, all the stakeholders are aware that, research is being conducted in the area. I think our research is very important in terms of also placing ourselves in the literature of social assistance in a deeply divided and post-war context. And I think that is an important contribution to both research as well as practitioners.